I 3D printed this model of the brain from CT scans of a patient who'd recently had a stroke. These new technologies allow us to actually show and demonstrate diseases like never before, enhancing the chance to inform patients, their families and carers about a specific presentation, injury or disease. Printing the brain in particular is always fascinating. It's the most incredible and interesting organ in the entire human body, and we have so much more to discover about how it works. The brain demands a very rich blood and nutrient supply, which arrives via the connecting arteries. A stroke occurs when this blood supply to the brain is interrupted. In this video, we'll look at how this happens, some of the risk factors, and what to do if you think someone around you may be having a stroke. There are two ways that the brain's blood supply can be interrupted and result in a stroke. The first is through a blocked artery called an ischemic stroke. This may be from a blood clot or a cholesterol plaque which blocks the vessels. The other type of stroke is from a burst artery that bleeds into the brain called a hemorrhagic stroke. When blood supply is interrupted through either of these two methods, some brain cells may die quickly, yet others might last for hours if there's still some blood flowing around that area. As such, after a stroke, the extent of damage presents as what's called a cerebral infarction, and which functions may be impacted can be highly varied. This is why after a stroke, a series of tests and assessments are usually carried out. There are many ways that a stroke can affect someone, and their recovery depends on different factors. These include the general health and level of activity before the stroke, whether it was ischemic or hemorrhagic, how much tissue was damaged, and the location of that damage. For example, a common form of stroke is a blockage of the middle cerebral artery, which is one of the brain's largest, and this can result in very widespread damage. However, there are many other arteries and small vessels where only select regions and functions are impacted. For example, blood vessels blocking the rear of the brain and the back of the brain may result in eyesight and vision issues. Other strokes in different areas may result in leg weakness, for example, or sensory loss. There are quite a range of variations and various presentations. Now, warning signs include sudden weakness or numbness of the face, arms and legs, and most often on one side of the body. Speech may be impacted. Sudden headaches, dizziness or blurred vision can occur. Stroke is one of the leading causes of mortality, so it is something to be aware of, and if you suspect someone is having a stroke, a quick series of things to focus on are the face, arms and speech. Does one side of the face droop when they smile? Can the person raise and hold both arms up? Is their speech slurred or strange? And if so, call an ambulance as soon as possible. Now, just also note the time when the symptoms appeared. Sometimes a stroke is preceded by what's called mini strokes. So you might see some of these symptoms occurring, but it then gets better. In these cases, still seek immediate medical care as a stroke can often follow. Stroke risk does increase with age. It's also more common in males as well as some ethnic groups. But there are some ways to reduce our general risk, with it being said that up to 80% of strokes can be prevented. Reduce your stroke risk by eating a healthy diet, maintaining a healthy weight, being active, don't smoke, and drink alcohol in moderation. But as always, having a healthy lifestyle will not only reduce your stroke risk, but also leave you feeling better in the long run.